Hi, and welcome to my channel. I am so glad to have you here. Today I want to cover something that's near and dear to my heart, and that's struggles of being a new grad nurse. If you want to find out how to overcome those common new grad nursing struggles, stay tuned. Subscribe to my channel. Alright friends, so first of all, let's talk about exhaustion. New grad nurses are exhausted. It's not a physical exhaustion, it is all mental.
Mental exhaustion.
From thinking critically for 12 hours straight, it drains you. You're constantly thinking because you don't just give a med because it's ordered, you think about it first. Is this medication appropriate? For example, we all learned about metoprolol in pharmacology while we were in nursing school. Well, before we give metoprolol, we know that we need to check our patient's blood pressure to make sure they're not hypotensive and make sure that their apical heart rate is greater than 60. So, do we always check it? The answer should be yes.
It better be yes.
Thinking critically, as a new grad nurse, we wouldn't just pass it because it's scheduled, because a doctor ordered it and it's scheduled. We don't just give it. We make sure that we are safe nurses and we check their heart rate and their blood pressure first. Thinking that way with every one of your patients, with every nursing intervention that you're going to do, can absolutely be mentally exhausting. As a new grad nurse, you need to make sure to take time to care for yourself. When you are so exhausted after a 12-hour shift, especially if you're working 2 or 3 days back to back and you just go home after a long shift and pass out, you forget to 1, drink enough water, 2, make sure that you are doing something to relieve your stress, because you're going to need to. Some people find that running on their days off help with relieving that extra stress. Personally, I don't run unless someone's chasing me. Hey, you could get together with any of the nurses in your unit and go on hikes if you enjoy, I don't know. But whatever it is that helps you to relieve your stress, make sure you find it and you do it every day. Take care of you. While we're on the topic of taking care of yourself, let's talk about protecting yourself. As a new grad, sometimes you can get overwhelmed with the amount of tasks that you have to do in one shift that you forget to take care of you. Protecting yourself at work is very, very important. If you have a patient who's coughing, make sure you protect yourself with a mask. If you have a patient who is in isolation, make sure you're wearing the appropriate PPE. Make sure you're washing your hands. Make sure you're just not using hand sanitizer throughout the day. Take time to use soap and water because we all know that's the best. As a new grad nurse, you're going to feel very anxious all of the time, and you're gonna feel like it's just you, like no other nurse has ever felt quite as anxious, quite as scared, quite as overwhelmed as you. Anxiety as a newly graduated nurse is something that we all experience, but nobody talks about. But why? During my first 3 months of nursing, I found that I was always feeling so sick. I was always feeling so nauseous. My head was always hurting, and I didn't know why. I thought, oh my gosh, what am I coming down with? I'm always so sick. And then I realized that my sick days correlated with my work days. So I'd always feel really nauseous the night before I had to work. But nights that I didn't have to work the next day, I was fine. So I was able to connect that this nauseous feeling like I'm gonna throw up is my anxiety from working this stressful job where all of a sudden you are responsible for other human lives. You know that when you're in nursing school, but I don't think it truly hits you until you are a nurse practicing independently on the floor without a preceptor over your shoulder making sure that you're doing everything right and who's there to catch any mistakes that you may have made, anything that you may have missed. So know that anxiety is real. Know that we've all been there. Know that to overcome that anxiety, you should get involved. Get hands-on. Any opportunity that you can find to do it repetitively will help to decrease that anxiety over time. Don't be afraid to talk to your nurse manager, to talk to your nursing peers, your senior nurses about your feelings, because let me tell you, we have all been there. Nobody is going to judge you for it, I promise. We know exactly what you're going through as a newly graduated nurse, because like I said, we've all been there. Don't be afraid to observe your senior nurses. When I was starting out, I did it all the time. I'd observe my senior nurses giving report. I would observe my senior nurses talking to physicians, having those interactions that made me feel really uncomfortable because I didn't want to do anything wrong. I didn't want to say the wrong thing. One of my greatest fears that I expressed to my preceptor while I was going through nursing school, or not nursing school, but while I was going through orientation in my unit, was that a physician would come up to me, ask me how his patient was doing, and my mind would go blank. And actually, not only was that a fear, but that happened all the time. My first 8 months in nursing, actually, that happened. Anytime a doctor would come up to me,
So, how is Mr. So-and-so doing?
my mind would go completely blank, and I'd be like, good? Let me tell you, I'm glad I'm through with that phase. But if you're going through it, that's okay, because I can laugh at myself about it now, and one day you'll be able to laugh about yours. Laugh at yourself about it as well. We've all been there. Trust me, it's okay. So, whenever possible, observe your senior nurses doing things that scare you. And that way, you can see how they approach it, how they tackle it, and you can mimic what they're doing until you are confident enough to find your own way of doing it. Now let's talk about fear. When you are a new grad nurse, or at least when I was newly graduated as a nurse, I was scared of everything. I was scared to talk to physicians. I was scared to talk to patients about their care, because what if they asked me something and I didn't know the answer to it? Oh my God, then I would look like an idiot and they'd ask me how long I've been nursing and I would say 1 month and they'd say, oh no, get out of my room, I want another nurse. That never happened to me or anyone else in my unit. And so give yourself a break. I encourage you to get involved in anything and everything that you can. If there's a code in your hospital, go to it. Get your hands on. Ask if you can push the meds. Don't just stand there. Don't be a wallflower. You're never gonna learn if you're not getting in there and getting dirty. Get your hands on the medications. Get your hands on the patient. Get your hands on the supplies. Do it over and over and over. That's how you master it. So yes, you're gonna be afraid that you're not gonna have the right thing to say, that maybe you'll say the wrong thing. I work in a unit I work in the ICU, where our patients and their families' emotions are high. You don't wanna say the wrong thing. Well, there's really not a perfect thing to say. Be confident in the education that you got in your schooling, and that those therapeutic communication tools that you learned are going to help you get through. So just remember, fall back onto the training that you got in nursing school. You were taught it for a reason. When you're dealing with being afraid, at some point, you need to just do it over and over and over again. Do the task, do it, face your demon, right? So whatever is making you scared, whether it's, getting an ABG for the first time or inserting an IV, just do it. Know that you have the tools, you've got the training, you've asked for help, you know the procedure, you've got all your supplies at the bedside. Believe in yourself. Go into that room, face your fear, do that task, or speak to that physician. Call him. If it's 3 o'clock in the morning and you're like, oh my God, I'm so scared to call this physician at 3 o'clock in the morning about this blood pressure. Should I? You've consulted all of your senior nurses and they're like, yeah, you should definitely call him. Just do it. Do it. Get it over with. Do it over and over and over again until it's no longer scary. Just face your fear. Nursing is scary. Healthcare is scary. So don't be afraid to ask questions. Ask questions about everything. If you are not 100% confident that you know how to do a task, that you know the ins and outs of a medication, ask. I ask questions all the time as a new grad, from questions that I was pretty sure I knew the answer to questions that I knew the answer to, but I wanted a senior nurse's opinion, just to make sure that my thinking was on track with what I should be thinking. So don't be afraid to ask questions. No matter how stupid you might think they are, there is no stupid question in nursing. Because remember, we are responsible for the lives and welfare of our patients. Be a safe nurse and don't be afraid to ask questions. I did that almost daily. I would ask my senior nurses, hey, in this situation, what would you do? I would ask my nurse manager, I have this difficult situation, how would you handle it? And there was actually a day when my nurse manager was out, my nurse mentor was not in the unit, and I didn't know my senior nurses well enough to feel like I could approach them with an issue without feeling judged. Please don't ever feel like you're being judged. But I went to my nursing supervisor, or the house supervisor for the whole hospital, and I said, let me just tell you. So there was a day I felt like I failed my patient. I felt like there was an opportunity to protect my patient and I had missed it, and in doing so failed my patient. So I talked to the house supervisor about it, and she made me understand the situation from a different perspective, and that was so beneficial. So please ask for tips, ask for help, because everybody knows you're a new grad. Every nurse has been a new grad. We all get it. We all give you grace. Please give yourself grace. When I was a new grad starting out, it was really important for me to identify senior nurses who I could go to, whose clinical opinion I trusted, and not only that, but who I felt safe going to. And by safe, I mean nurses who I felt like didn't judge me for my lack of knowledge, but also were confident in my nursing skills. That was important to me, to feel like I could go to senior nurses with questions without fear of judgment. So, know who your go-to nurses are. You may not know at first. I've heard stories from nurses that I went to school with who have gone to nurses for help, and the senior nurse's response has been,
You don't know that? What school did you go to?
Don't take it personally, because that nurse making that comment has been in your shoes. Maybe they've forgotten, maybe they've become jaded. Who knows? Just shrug it off. Don't take it personally, and know in the future you're just not going to go to them for help. End of story. Nursing is hard. I don't think that's something that is talked about ever, But you know, you go through nursing school, and nursing school is so hard. You pass the NCLEX, you have your license, you have the job, and then you become a new nurse and you're so excited only to find out it is so hard. Being a new grad nurse is a struggle that nobody talks about. Nobody tells you beforehand how hard it is going to be. And so then you're doing it, and because nobody talks about it, you think,
am I the only one who struggles as a new grad?
no, you're not. Every nurse struggles. Everyone knows it's hard. I don't know why we don't talk about it enough. It's hard. Nursing is hard. But you get through it, and it gets easier and easier and easier every single day. You got this. You can do it. That's another huge thing, is that I definitely felt like, as a new grad nurse, I had feelings of, oh my God, I hate nursing. I can't believe it. And I can't believe I just said it, because I never verbalized it as a new grad nurse, and I've never verbalized it since. But here I am saying it. When I started nursing, I hated it. I truly believed that I had made a mistake, that I went into the wrong profession, and that I just wasn't meant to do it. I believe that almost all newly graduated nurses feel that way. You are so stressed out. You have high anxiety, high fear levels. It's a whole new thing, and it's very hard. Nobody tells you how hard nursing is going to be. And it's not the charting, it's not the patients, it's not the physicians, it's just all of it. You've got so much all of a sudden that you are responsible for, and that is tough. You no longer can say, oh, I'll ask the nurse, or I'll get the nurse for you, because you are now the one responsible for answering all of those questions. You're responsible for being an expert on your patient. And that's a lot. That's heavy. That's a lot of responsibility. I suggest to you, find a mentor, someone who is like-minded. You know, when I was thinking about finding my mentor, I wanted someone who I felt like was very similar to me. I love that marriage of science and art when it comes to nursing, and also I love the relationship-based care aspect of it. And I found someone who believed in those same things, and I asked him to be my mentor, and he said yes, and it was the best thing that I could have done, because he's been there for me when I've cried, he's been there for me when I've laughed, he's been my champion. And so please find yourself a mentor, someone who you look up to, someone who has similar goals as you, someone who reflects who you aspire to become as a nurse. They'll help you through those tough times when you've got a really sick patient after you have your first patient death. They'll cheer for you on those days when you do amazing, awesome things, when you get your first IV, when you get your first ABG, whatever it may be. They will be there in your corner to help cheer you on or lift you up. Find a good mentor. New grad nurses, it's very important for you to know you don't need to memorize everything. Nursing school's over. The days of cramming all that knowledge, the days of feeling pressure to memorize everything, it's over, it's gone. Nobody expects you to know everything, because there is no one who can possibly know it all. Nobody. Even doctors collaborate. They ask each other questions because nobody can know it all. Don't feel like you have to memorize everything, because you'll just frustrate yourself. Instead, make a binder. I have a huge reference binder that I keep in my locker at work. Make lists of daily tasks or of tasks that you don't do often. I work in the ICU. We don't discharge patients directly from the ICU very often. So I've got a whole section in my new grad binder that helps me to go through the steps of how to discharge a patient. I've got different sections on medications that we don't use often and how that affects my patient. So make yourself a good reference binder with both things that you do often in your unit and things that you don't do often in your unit. As a new grad nurse, there's so many things to learn. Don't worry about memorizing everything. You'll get it eventually. Just knowing where to find that information, knowing your resources and your references, those are going to be the things that make you successful. I want to talk to you about making sure that you are enjoying your journey as a new grad nurse. There's not going to be any other time in your life that you are a new grad. It's terrifying. You're going to have lots of anxiety. You're going to be exhausted. It's going to be hard, but it's temporary. Being a new grad nurse only lasts for so long, and then you become an established nurse and then a senior nurse. So enjoy it. Don't put too much pressure on yourself. Enjoy the journey. Keep in mind why you became a nurse. For me, I became a nurse because I love the nursing model of holistic care, caring for our patients, mind, body, and soul. And that's what I remind myself every day. In every shift, I try and make time to pull up the chair and get to know my patient. There's nothing that fills my soul more than having the opportunity to sit with my patients, look at pictures of their grandchildren, hear stories about wonderful things they did throughout their life. Those things fill my cup of joy. Make sure that you are taking time to enjoy the journey and doing what fills your cup with joy. Being a new grad nurse can feel overwhelming. It can feel like you are drowning and your head is just barely above water. We've all been there. But remember, you have a team around you that can lift you up and build a raft around you. I think a lot of times new grad nurses are scared to ask for help. They're scared to delegate, or maybe they're just hesitant to delegate. Maybe it's because we feel like we should know the answers. Maybe it's because we feel like we should be able to handle it all. And if we can't, well then maybe the other nurses around us will think that we're not good enough. Maybe we're scared that if we can't do it all by ourselves, that we don't deserve to be in this position as a nurse. Don't feel that way. Even our most senior nurses need help. That's just nursing. It's a community. It's a team effort. It's not a solo effort. I don't know if that makes sense, but it's a team. Nursing is collaborative. You always have people to reach out to. You've got your care coordinator. You've got the chaplain in the house. You've got your charge nurse. You've got your senior nurses. You've got your mentor. You've got your manager. You have resources. Reach out, get some help when you need it. Don't feel like you have to do everything on your own. There's no one who's a super nurse who can do every task all on their own. And remember, nursing is 24-hour care. You are not responsible for doing every single thing that the doctor ordered right now. Don't feel stressed. Don't feel like you are responsible for everything, because nursing is a team effort. It would mean so much to me if you would click the like button and subscribe to my channel. Thank you so much. I can't wait to see you next time.